I've been positive for 23 years. And when I first came out to my family, their first reaction was not about myself or about my health status, was about what would other people think about our family. I know they worry about me, I know they love me, uh, but their first knee-jerk reaction was about saving face. As someone who's positive, I want to have support from my family. I think it's really important in terms of healthcare, self-care. And when your family doesn't react the way that you would see in movies or from other possible other families or white families. Even to this day, after 23 years, uh, my parents still aren't comfortable talking about illnesses or about my HIV status. How they go about it is very indirect, which is very cultural as well. They would just mumble to me, "You're okay, right? You're still okay?" I'm like, "Yeah, I'm fine. I'm still good." But it took me years to try and understand that my parents will never be what I need them to be. But I know that underneath it all, they do love me, they do support me. It's just they can't express it they express it in their own roundabout ways. I have a partner of 20 years. His name is Lee, and we also got married 5 years ago. He knew my status from the very beginning. And I was surprised that he actually wanted to be in a relationship with me. Didn't flinch. He, he's negative himself, and he still is negative. So I think he's told his family about my status, but I haven't said it to them directly. But also but also the dynamics with his Vietnamese, and so his dynamics with his family is also very interesting, because he never even officially came out to his family as being gay. I just started showing up one day and just never left. And so they've been really welcoming uh, about us, even though they never talked about it. They've been overwhelmingly supportive about our relationship. I just don't know how much they know about my HIV status. I think that the way that Asian Pacific Islander HIV organizations approach the work has been really on a holistic way. It wasn't just about health, it was about community. It wasn't just about getting you medical care. It was about making sure that you had access to services, that you were being supported in every step of the way, and not only with your medical care, but also with housing, with interpretation, with language, um, with transportation, and coming out, how to disclose to your family. It's about helping to find a family outside of your biological family. One of the main challenges that we have is data. That regions around the country that have a larger population of Asians and Pacific Islanders, they do collect racial data. When you look at data across the nation, we're not well represented. I think one of the things it's been ongoing from the onset has been because our numbers are relatively low and compared to African Americans and Latino populations with HIV prevalence, is that we don't get the resources. And so I think the challenge with our communities that we've always been fighting for is just the lack of acknowledgement that we are getting infected, that our numbers are increasing, and yet the resources that's being made available is almost non-existent. Asians tend to get tested later on. We don't think of preventive health as a thing. That's just not part of our culture. Growing up, illnesses was not something that we talked about. Death wasn't something we talked about. Same with sex and sexuality was not something we talked about. The only time when you went to the hospital is when you were sick, and that's when you were really, really sick, that it can't be taken care of by, you know, by aspirin or by Vicks vapor. Vicks was in all of our medicine cabinet. So what that means in regards to HIV/AIDS is that it's only when people started having symptoms is when they go get tested. I got a call from a good friend of mine here in the Bay Area, who's been part of the active in the gay community here for a number of years, but he was in the hospital and diagnosed with, he had a flu. That was the first time he found out about his HIV status. Even though for years he was active in the Bay Area in the gay community and knew about HIV and was well educated and well supported and knew about services, how to access services. That wasn't the problem. It's just that he did not get tested until he actually had symptoms of being ill and to a point where he was diagnosed with PCP. For the last 14 years, one of my projects was actually working in the US Pacific Island jurisdictions on health disparities and HIV. There are some main differences in working and the services that's provided there versus here in mainland US. The islands are separated by 1/3 of the world's ocean. So it's just not as easy as going in your car and traveling down, down a few miles to actually get HIV services. The main HIV services are with public health. And so if you don't have access to get to that location, you basically have no services. I think, we're still dealing with the same stigma with our families, the saving face, that not wanting to talk about illness and death. We're still dealing with coming out as not only with being gay, but then now with HIV. Disclosure, getting support from family, not only family, but also with friends. The only thing now that's changed that there's hope in that we are basically, it's not a death sentence, that we can still plan a life, which I couldn't even imagine when I first got diagnosed. We have a future that we didn't have before. But everything else in terms of stigma, is, I think, still the same.